Now, prevention, basically, there are two aspects of prevention. That is the primary prevention, which is preventing heart attack itself before it occurs. And that is primary prevention. Secondary prevention is a person who has already had an heart attack, how you would take care of him. Like, for instance, we talk about cardiac rehabilitation. Like how you help a patient who has had an heart attack come back to normal, get back to his normal life, his quality of life and everything gets maintained, and how he is able to get back to his work and lead a normal life. So that becomes the secondary prevention. So the important point here is, if you go by the global statistics, not only is the incidence of heart attack highest in our population, but also the incidence of the morbidity or mortality, which is the death or the worsening of quality of life secondary to heart attack, whatever the worsening of quality of life is there. Even with that aspect, India is predicted to become the cardiovascular disease capital of the world. So what does that mean? So one thing is, our population is prone to this particular disease, that is with respect to primary prevention. But when we see that the morbidity and mortality also is highest in India, that also means that there is something wrong with even with our secondary prevention. That once a heart attack occurs, we are not able to curtail the disease and get the patient back to normal. So that sense, prevention becomes very important.
Okay, so what do you give as the couple of takeaways for preventions, now that you said that these common signs and symptoms for older people, that is not even matching with the younger population. So how do they see something like this coming in their lives?
One sad aspect of this prevention when we talk about is that in our society, daily life, prevention is becoming more of a commercial entity, where all the labs and the private labs are trying to make it more and more. You have these packages which keep coming up. You have this 10,000 rupees package, 20,000 rupees package, and people who do have this health consciousness, they get succumbed to this. But what I would feel is, more than making it a commercial entity, the most important point here is lifestyle, your diet and lifestyle measures. But along with that, what I would say is, you would rather meet a doctor first and then go for a health checkup, rather than the present style what is happening, where you get an entire health checkup package and then you meet a doctor. Or you end up, many people have this self-diagnosing where they go to Google and check up their reports, and so that is not primary prevention in its true nature. That is not how it is supposed to be. Primary prevention is supposed to be, first part is more of health awareness. Annual checkups are obviously to a certain extent helpful, but it has to be more about awareness, which has to come right from the primary education level. That is the most important. We would like to have CBSE curriculum where you have an entire subject or a part of a subject having this as its topic, where we talk about only and only prevention, and it does not have to be only with the heart. It has to be primary prevention to lead a good healthy lifestyle.